In Impact Phase D, we move into high-level sport-specific movement by repeating the Phase C routines. Starting with the dynamic sports warm-up, then on to the sport cord and agility ladder drills, adding both intensity and repetitions.
We begin to integrate a dynamic warm-up. It's kind of a calisthenic-based warm-up, and it kind of covers the body from head to toe. It usually takes about 5 minutes for the athlete to run through. Jogging in place, we're going to do this for about 30 seconds. After 30 seconds, we're going to have them do arm circles forward, walking down. We need about a 12 to 15 yard area to do this warm-up. And back. And normally we would have her do 2 laps here. We're going to do arm twists, trunk twists. So she's walking at a brisk pace. We want to keep moving throughout the exercise and warm up here. This is also a good way to kind of assess her readiness to move. She's going to do hip circumduction, keeping moving. She's going to open and rotate the hips and stretch the groin. So as I said before, normally we're going to do 2 laps of each here. We're going to have them go into a skipping bound motion. So I want her getting that front leg nice and high. Like I said, this is a good way to assess someone's ability to both push off the affected leg and see if they're favoring one leg or another. Okay, now we're going to move into high knees. So she's going to try to get as many touches as possible. And we're going to move into gluteal kicks. Keep moving the whole way through this. A lot of these movements are actually what we use on our return to sport test too. So it's a good thing that we have athletes practice this when we get to that point. Okay, now we're going to move into side shuttles. She's going to face one direction, stay in that flex knee position. And she's going to do 2 laps like that. Now we're going to move into cariokas. Important with this, what I want her doing is turning from the hips, not from the knees. We don't want to be twisting the knee. She's going to come back facing the same direction. Okay, now we're going to have her sprint forward, and she's going to backpedal. Okay, lastly, we're going to have her stand in place, and she's going to bounce up and down off her toes, and that's the dynamic warm-up. We're going to do this for the remainder of the protocol. We transition them into the sport cord. With the sport cord, we're going to use this for the next 4 weeks. In Phase D, we're going to move it up to a 3/4 pace. So go ahead and ramp it on up. So it's near full sprint here. The added resistance just makes the muscles work overtime. This is really forcing the glutes and hamstrings to drive. Okay, and after that we're going to spin her around and we're going to do the same thing backwards. And as we get into Phase D, we're going to have her go at 3/4 pace here. So really driving through those legs. Good, and that's sport cord forward and backwards. Starting in Phase E, we also begin side shuttles in a lateral motion, the coronal plane. This really works on drive and getting the athlete ready to begin agility and cutting drills. So we'll have her get in that flex knee position, that sport ready position, and then drive to the right through the legs, picking the feet up, and then back. Usually start with 20 repetitions, and we'll repeat this facing the other direction, so both legs are worked equally. And you really will notice a difference a lot of times in the push off and power out of the surgical leg. The last of the lateral bounding exercises starts in Phase D. This is lateral bounding with rotation with the sport cord for added resistance. So it's going to be the same form we've been doing. She's going to turn and land in that flex knee position, moving from the coronal to sagittal plane each time. Good. That's 3-point lateral bounding with rotation with the sport cord. Starting in the second week of Phase D, we continue to progress the sport cord exercise into what we call the 3-point drill. We're going to do this both forward and backwards. So what I'm going to have Katie do is she's going to run forward to the first cone, and then she's going to shuttle over to the right, touch the cone, back to the middle, all the way over to the left cone, back to the middle, and then she's going to go backwards. So this is a multi-planar exercise.
And as she gets comfortable, we're going to ramp up the intensity. So we're going to do 20 reps in a row here. So when you're ready, and she's going to continue and repeat that. Good. And then I'm going to have her turn around and we're going to repeat this going backwards as well. This works a little more on the quadriceps by going backwards. So I have our patients get really low and drive through their legs. So I always have people start slow and then ramp up the speed and intensity. So go ahead and ramp it up a little bit here. Good. So this is the 3-point sport cord drill, both forward and backwards, that we do at the second week of Phase D. Starting in Phase C, we move away from the step agility exercises and move into the agility ladder. This is more sport specific and puts a lot more demand on the knees. She's double touching in each rung here. Okay, and we usually do this 3 times. The next one we'll do is lateral high knees, which she's going to move in the coronal plane with her legs pumping nice and high. Her hips are controlling where her knees are in space. We go back facing the same direction, working the legs a little differently. Then we go into lateral quick feet, which are ins and outs, and we're going to do this 2 different ways. We're going to do the first one with her leading with her front foot. This challenges dexterity, so she's going to go in and out, and then go for speed. And she's going to go back facing the same direction here. So this is lateral quick feet, in and out with front lead. Now we're going to reverse this, and she's going to do back foot leading. But you can see there's more rotation in the hips with this. It's a little more challenging movement. This is lateral quick feet, in and out with the back lead. From there, we'll move into the ollie shuffle. She's going to, it's very similar to what we were doing on the step. She's going to jump up and switch her feet, moving in and out each rung. So a lot of rotation at the hips, and she's going to reverse that. When we first start these, usually we do 3 times down and back of each exercise. The last one we're going to run through, we call the Icky Shuffle, and this is our first real hard cutting exercise. So she's going to start cutting on that outside leg, and she's going to go back doing the same thing here. So these are the ladder agility drills that we do up until the jump program begins.